I'm Zade Shaw. I'm a neurologist at Hamilton Physician Group Neurology with Vitruvian Health. Grew up in small town Indiana, New Haven, Indiana, right outside of a bigger town, Fort Wayne. So small town life until college. It is sort of stereotypical what you might think of. You've seen the movie Hoosiers and all the cornfields. I was more of an intellectual type than an athletic type, but I did Taekwondo for my high school years, and so that was my athletic outlet. And really, that was actually a very influential thing upon me to get into the Taekwondo, because it was more about the discipline and the respect for myself and others that I learned in that really made a difference. The values of giving back and things. So it was huge. It was a hugely influential piece of my growing up years there in that small town. I have a wife and 4 kids, so we have a lot of fun. It's very full, but it's you know, they are what really keep me, or part of the reason that keeps me balanced and present. My interest in becoming a doctor came later. Initially, my undergraduate was in engineering, and so worked in that field for quite a few years. For helicopters, working on helicopters, mostly for the military. But then I made friends. I had been friends with someone whose dad was a doctor throughout college. And as I became more and more a friend of both him and his dad and the whole family, eventually he influenced me to move in that direction and become a doctor. And I decided I wanted to do it, wanted to make a career change. So after 7 years as an engineer, I went back to school and did medical school. And then the rest is history. My educational journey started at Purdue in Indiana for engineering, and so then worked in that field for 7 years as an engineer, helping to develop helicopters. And then after I made the decision to go back to school, I did some pre-med courses again at Purdue, and then did medical school with Indiana University. And then all my residency was with IU at Indianapolis. And then we moved here to Chattanooga and now North Georgia. The reason I moved into neurology was sort of a philosophical reason at first. I felt that of all the fields of medicine, it was the one that most encompassed what makes us human. The brain and consciousness, our memories, it all centered around the brain. So I knew because of that, oddly enough, that I wanted to do something with the brain. With the move from engineering to medicine and neurology, I wanted something that would be combining that world of the intellect and figuring things out and a problem to solve with interacting with a real human being, and having that place for empathy and human interaction. It's a big aspect that I enjoy more than anything with my work, is that I get to have, you know, those human interactions and then hopefully be of benefit to the patients. And when they tell me that I've made some difference, or that some have said even that I changed their life, you know, I'm blown away by that. That the things that I've learned then can translate very practically into helping someone in their life. The philosophy that drives me would be that I'm a Christian, and so that's my background. And so my belief in God, my faith, motivates me in everything that I do to want to help others and, you know, listen carefully to what they're telling me, and then hopefully use what I have learned to be a benefit to them. To be a curious person and not just assume I already know the answer, but to be a careful listener and then show them respect. So yeah, that philosophy is behind everything I think that I do. There are so many different things that would make someone want to seek care with a neurologist like me. You know, but some things would be if you're having headaches all the time or migraines, if you're having symptoms of a pinched nerve, whether it be like carpal tunnel syndrome in your hands or a pinched nerve in your neck or back, whether it be you're having memory problems, that's a big one that I see plenty of in the clinic, memory issues or other issues that might lead you to think that you're having the beginnings of something like a dementia, whether it be Alzheimer's or Parkinson's dementia or other kinds of dementia. We see plenty of that in the neurology clinic. I would want patients to know that I'm going to endeavor to be a very careful listener as you explain the problems that you're experiencing, and that I'm going to come at it with an approach of I want to explain to you in terms that you can understand what tests or procedures I think that we need to do to explore this further. Because I know that neurologic problems, they can be intimidating a lot of times, or even frightening. If you're losing your memories, for example, or if there's some spells of dizziness, for example, these things can be frightening and intimidating. When I see that I'm making a difference in someone's life, that would be certainly a key element of the driving force of things in my life. So if it's with a medicine, or if it's with another recommendation that I've been able to make, a referral to a specialist, a subspecialist, or to the therapist, whatever it is, if I feel like something that I have done has been able to make that impact for the patient, then that would certainly be an element of the driving force in my life, absolutely.